Take the drug holiday. Numb yourself out.
I think you're the one who wants to numb himself out.
How did your dad react when you came out to him?
He made me tea. I changed my mind. Dare. Just no nudity.
Show your breasts to Taub.
I'll show my breasts to Taub. Tomorrow, perhaps.
How do you feel about your sister?
I hate her.
Did you do anything to the baby?
No.
House is definitely not having the best day with this morphine drip. First the gut absorption thing, and now he says he can take off the regulator like the patient has a hit me button that he can just press for more. Very excited to be reacting to housemd Season 6 Episode 17 Lockdown. On this channel we are reacting to all 177 House episodes, and this will be 128. Let's see if I can get the diagnosis before House does as a doctor working in London.
How about the name Brooke?
She just doesn't seem like a Brooke anymore.
How's Paige? What are you doing here?
Can we talk somewhere?
I was thinking, Sarah, where's the baby?
No one saw anyone go in or out, and the baby's not in the nursery.
How long were you out of the room?
15, 20 minutes tops.
Call the police, shut down all the exits. We were on lockdown. Nobody moves until we find that baby.
Why won't you sign the divorce papers? Will you sign them?
Not until we have a real conversation about our marriage.
I made a mistake coming here. I'm sorry.
Code 7. All non-essential personnel and guests, please remain where you are. We cannot allow anyone to leave the hospital at this time.
Did anyone other than your nurses ever come by asking about your daughter?
I need to help them. Look, I don't want to relax. I want to find my baby.
The police are searching room by room.
What if she needs to be
We're
fed?
gonna find her.
As a father to his 17-month-old, I cannot imagine anything more terrifying than not knowing where my baby is. To those of you who aren't parents, the love you feel for a child is like entering a new dimension of emotions that you didn't even know existed. It takes time to feel that way and it grows with them, but to have this incredibly precious cargo now go missing, that's a tough pill to swallow, even in a hospital. So what do we know about the situation so far? The baby was apparently wearing a proximity alarm bracelet and none of the exits have detected it, which means the baby should still be in the building. It could also mean that the band was cut off, left inside, and then the baby was taken out, but presumably that would cause an alarm as well. So safe to say the baby is here. We also know that the reason why they're still in hospital is because she was born 5 weeks preterm, because of the mum's preeclampsia. None of that helps us to figure out who the culprit is here, but has this ever happened in real life? This story is so wild. They even made a movie about it. Carlina White was just 19 days old when she was taken from Harlem Hospital Center. Her parents took her back in and she needed antibiotics because of an infection from swallowing fluid during her delivery. At 2 a.m, a woman came, removed the baby's IV line and took her from the hospital, raising her as Nedra Nance. This carried on for 23 years. 23 years! The police couldn't solve the case, and it was only when Carlina was pregnant herself and tried to get insurance that she asked her mum for a birth certificate, which the authorities told her was forged. She then confronted her captor, who admitted she wasn't the biological mother, but said her real mother was a drug addict who abandoned her. That's when Carlina went on to National Missing Persons records and found photos listed that looked exactly like her infant photos. She cracked her own case and was reunited with her birth family. Petway admitted to the crimes and turned herself in, stating she did it because she was depressed after having multiple miscarriages. She was put away for 12 years and was released 3 years ago. This is the exact situation that we're trying to avoid here. Also interesting that Cameron is now stuck with Chase in this lockdown situation. Could a tragedy like this be the spark that ignites their trans-Pacific flame? What other clues will we get? Let's find out.
Why aren't the police talking to our nurse?
Truth or dare?
Oh, no, you don't want to mess with me. Truth or dare queen in Newton North.
They think I took the kid. The dad let the older brother hold the baby for the first time. After a few seconds, she shrieked. It was sibling rivalry. I thought it was kind of ordinary.
What are you doing down here?
I was looking for McKenna's patient file.
The one I said I'd get?
2 hours ago.
You know what these are? The staff credentials files. We could look up anything on anyone. What if we just snoop on our boss?
I think I can live with that. You're on 2 milligrams of morphine an hour. How the hell are you still awake? The blood's not reaching your gut. You have intestinal hyperperfusion.
You're Dr. House, aren't you?
Heart disease is kind of below my pay grade.
It started as tooth pain. You're standing here watching me die because of my file bored you.
A good argument for there being more than one me.
Have you ever had a threesome?
No. And by the way, you didn't ask me if I'd had a foursome.
Walker wouldn't do anything. He's my son, too.
He's your stepson. We can't ignore any possibility.
Last week, he hit another kid with a book, hard enough to draw blood.
I love the parallel storylines here. You've got House stuck with a patient whose case he rejected, 13 potentially admitting to a foursome. We find out the patient's son is her stepson who's been dealing bludgeoning strikes, and all while Taub and Foreman are digging up dirt on the boss. I know the team have quite literally dug up skeletons before, but they weren't in House's closet. There was a huge mistake earlier that I have to point out though, and that's with House and his new roomie. House mentioned that he should be asleep because the morphine drip is at 2 milligrams an hour, which isn't quite accurate. You'd need probably 3 times that to put you to sleep, and not only that, House justified it by saying he had a lack of absorption to the gut. The gut! Where does he think the infusion is going? That needle runs straight to the skin and is absorbed from there. So if the patient's heart isn't working, then in all fairness, it could reduce skin blood flow and therefore absorption that way, but definitely not from the gut. House also mentioned that the 1 to 2 days that the nurse gave him was generous based on how he looks. But what's really happening here? Is this going to be a lesson to House that he needs to take more cases? Will this situation lead him to accidentally save the patient's life? House mentioned he only takes 1 in 20 cases. How many of the others could have been savable? And does he even consider that? Definitely some very interesting dynamics going on here and makings for a good episode. Let's get more clues.
There must be over 30 malpractice settlements in here. Patient lost 4 liters of blood from a botched penisectomy.
Patient named Lisa Cuddy?
He's not even here and he's screwing with them.
You really want to get into his head? You confiscated him from a drug seeker in the clinic.
It is after hours. Walk in House's shoes for a night.
I was a classics professor at Princeton for 26 years.
That must be it. That's you have no friends because, say, you're a miserable bastard. I can unlock the regulator. You can put yourself in a narcotic haze.
No thanks. You think a classicist doesn't believe in fate?
Take the drug holiday. Numb yourself out.
I think you're the one who wants to numb himself out.
How did your dad react when you came out to him?
He made me tea. I changed my mind. Dare. Just no nudity.
Show your breasts to Taub.
I'll show my breasts to Taub. Tomorrow, perhaps.
How do you feel about your sister?
I hate her.
Did you do anything to the baby?
No.
House is definitely not having the best day with this morphine drip. First the gut absorption thing, and now he says he can take off the regulator like the patient has a hit me button that he can just press for more. Those do exist, but they don't have a constant infusion rate like the one that we saw earlier. If House took the regulator off this one, the patient would need to manually up the infusion rate on the machine, and he barely has the strength to get up. Otherwise, House would have to do it, and that would be a lot more than just unlocking the regulator. Interesting though that even while he's stuck in a room, he still has the time to mess with his nosy colleagues. Seems like the stepson Walker is the primary suspect now, but can sibling rivalry really stem that deep? One study by Volling and colleagues actually looked at 60 families who had a 16-month-old toddler and a preschool-aged sibling. Even though jealousy was almost always present, it was the quality of the marriage relationship that was the strongest predictor of how well that jealousy was regulated. There was also an influence based on natural temperament and the older child's emotional understanding. That leads us to wonder here, what happened to the father's previous partner? The stepson has already seen his parents break up, which is so traumatic for a child that it even scores them a point on the childhood trauma questionnaire. Keep in mind, other things on that questionnaire are things like not having enough to eat, being hit so hard that it leaves marks, or being touched inappropriately. I have to admit, I still don't think it's the child. The mother couldn't do it, so maybe it was the dad. Could he have gone out with the baby while the mother and his son were asleep? Maybe he was overwhelmed by the behavioral difficulties of the first child and couldn't handle another. Could he have not wanted another child but was pressured ushered into it by his new partner. Also, how have they not checked the CCTV yet? All those cameras, and for what? Either way, it's going to be interesting seeing Taub on this Vicodin trip. He doesn't quite have House's 188cm frame, even though he's taken a full dose. Can he handle it? Let's find out.
Bad pain day.
Bad pain month. I was in rehab. Now all I take is ibuprofen and it's 2 flights up.
What time is it?
Tell me who she is and what are the pathetically long odds that she's gonna visit or call.
Dude. Is the room still spinning?
Hit me in the face. You know you always wanted to. I wasn't ready.
This is your credentials file?
Okay, Robert, I will answer whatever questions you want. Then you're gonna have to sign the papers.
Did you ever love me? The first time you slept with me was because you're on crystal meth. You couldn't give up the idea of having your dead husband's baby.
Don't bring him
Because
up.
even then, you weren't sure about me. Just tell me the truth.
Oh, what?
Did you ever love me?
I don't know.
Thank you for finally telling me.
What? It may not seem like it here, but Cameron did Chase a favor by filing for divorce. If she didn't actually love him, then the chances of them having a satisfying marriage are slim. Breakups are obviously traumatic, as part of our personal identities are tethered to the partner we're with, meaning our persona shatters into 1,000 pieces. This explains why Chase has been so explorative and questioning his very existence as he learns to be on his own again. Very good from the writers. But what does poor marital satisfaction actually affect? Well, Robles and colleagues actually looked at more than 70,000 people from 126 studies and found that marital quality is related to how good someone's general health is and even their risk of dying. These effect sizes were relatively small, but still significant. We also know that greater marital quality also helps child development and their regulation of emotions. Speaking of those though, it seems like House is hiding his emotions as his pain is slowly getting worse. He mentions that it isn't just his lower leg anymore, but it's actually moving upwards. That could be a change in the way he's perceiving the pain, or less positively, there's an arterial blockage that's climbing upwards. House knows he needs a special scan of this, but is holding off because he's scared of what it might show. Still no signs that our classic professor is salvageable, but I have hope still.
You're too much of a nice boy, Wilson. Let's let the bad boy out for a bit. You have to go steal $1.
Oh, come on.
Fake the lab result. Very wrong.
I needed to beat all those elite spoiled kids around me. Why did I just tell you that? I didn't think I deserved to be at a top med school in the first place.
This isn't about med school. You don't think you belong here.
Dr. Taub.
Either you left her for a reason or she left you for a reason.
It's my daughter. I was sort of forced out after I'd had an affair with a student. I just wanted to speak to her one more time. That's my story. What's yours?
I like being alone. And then I met someone at a psychiatric hospital. She changed me. And then she left. We suffer alone, we die alone. Tomorrow will be the same for you.
But yesterday would have been different.
This patient is chipping away at House's despair like a miner searching for treasure. A bit of charcoal hopelessness to the left, some granite cynicism to the right. And what is that? Have we hit some diamond joy? Maybe not quite yet. Interesting how House described his relationship in the psychiatric hospital, though, and not with Cuddy. That was unexpected, but actually makes perfect sense. In the whole series, it is one of the only times that we've seen him truly happy, when he's sitting there playing the piano and sneaking out of the hospital. He even managed to get his sister to break out of the mutism as well, but alas, all good things must come to an end. I know House says that he prefers to be alone, but the evidence now seems to not match that. He's staying with Wilson, he enjoyed inviting Cameron out for monster trucks, and spends long nights on stakeouts with Lucas. It seems he's convincing himself that's what he wants to avoid the pain of people leaving. Speaking of which, how are so many characters here actually single? Chase, single. Foreman, single. 13, single. House, Wilson, Cutner, when he was here, is literally just Cuddy and Taub in relationships, and Taub seems to be cheating on his wife again. Is it just more fun and drama when people are single? I suppose there isn't much else to appeal to the viewer's heartstrings when everyone else has a happily ever after. Also hilarious that 13 made Wilson commit a crime. He's so suggestible, although it was truth and dare. What is the funniest dare you've done? Let us know in the comments.
I spent months wondering how I made it go bad. I didn't do anything wrong.
I did love you. Just not in a way that would have ever worked. I'm a mess. I'm unfixable. Not you.
I'm sorry.
I didn't even play fair. And the Huntingtons. I never told him.
You can't suppress your life for his convenience.
That's exactly what you do for House. You bought a bigger place for him.
Ex number one. She friended me a few weeks ago. I wanted to ask her out.
You're not worried about House, you're worried about yourself. Because she's an ex. So even dinner will mean it's immediately serious.
What are your favorite parts?
I liked watching you stand up to your dad at Christmas when he yelled at your mom. Hey, you didn't even know you were strong.
I think about that dance class that we took for the wedding. I think he's never gonna hold me like that again.
Led a group of surgeons to fix cleft palates in Bangladesh? Why are you pretending to be ashamed?
I thought I'd be House someday. Your life's been trending up.
Taub went to Bangladesh to do humanitarian work and he wants to hide it. Modesty is reserved for people with smaller noses. Trust me, I know. Interesting though that Taub said he would swap his file with Foreman's because Foreman has been continuously on the up, but Taub peaked early. But remember what Taub said earlier, that Foreman didn't feel like he belonged? Yeah, that's a confirmed case of imposter syndrome if I've ever seen one. You've probably heard of it and know what it is, but did you know how many people actually feel like that? 80%. Why is it so high? Well, because they doubt their skills, talents, and accomplishments so much that they fear they'll be exposed as frauds. This is despite external evidence proving otherwise. They feel they're not actually as smart as others think they are. People who are perfectionists, introverts, and less agreeable are more likely to have it. I mean, I know I've felt like that before, although it comes and goes. I first heard about it when I was sitting in my master's class and the teacher ran an experiment. Imagine you're sitting there in your classroom, she says, "We've made a mistake on one of your applications and you were admitted to this class by accident. The skills you had weren't sufficient to make it onto this course, but you got on anyway. The work you've done so far has reflected that, and now we found out your true abilities, then it's time for you to leave." She then asked who thought she was talking about them, and almost everyone put their hand up. People are so interesting. So what can you do if you have it too? Try not to have that feeling of worthlessness control your actions. Embrace the fear and move forward with it. Use objective evidence of your past achievements to disprove your feelings and help others reject their own imposter beliefs by showing them their abilities and talents, which will be a well-deserved reminder for you. An unusual but enjoyable episode for sure. Surely Chase and Cameron can't go through with this divorce. Oh yeah, and the whole missing baby thing. Probably should sort that out too. Let's see.
No news.
Do you have kids? A little girl. I adopted her last year.
What if I can never love Walker the way I love my daughter? Does that make me a horrible person?
Did you request some extra towels?
No.
There are 8 towels in Sarah's room.
I need you to track down their logs.
What's wrong?
The hair on her left arm is standing up, and she's having a pilomotor seizure. She could have taken the baby.
Never really did have a proper goodbye.
It's 9 o'clock.
I can't come to the phone, so please leave a message.
You waited until you knew she'd be out.
Every now and then I just call to hear her voice on the machine.
Just tell her what you need to tell her.
Gracie, this is your father. I love you.
House loves to put on a brave, cold face, but have you seen what this man does for people? Helping them fulfill themselves one person at a time. He got Taub to send his wife dirty messages, Foreman to make peace with his brother, now the patient to tell his estranged daughter finally that he loves her. That joy diamond is starting to peek through the rocks. House is giving this patient something that many of us sadly don't get to fulfill: closure at the end of life. I used to work in a hospice and I've seen hundreds of actively dying patients over there. When they have just a day left, sadly this isn't how they look. Frequently, they're not conscious, their breathing is labored and automatic, with secretions building up on the chest. Those words they were waiting to say never get said, which is why it's important to plan ahead. I've said this before and I'll say it again, we only live for 4,000 weeks. That's it. It's not as long as it feels, and that's a great thing. Death brings renewal, allowing for the next generation to take over. How valuable would time be if we didn't have a limited amount of it? So that dream that you have, that idea you'd want to be working on, that person that you wanted to say that you love more, start today. Even if it doesn't work out, you'll learn something, and then when you look back, you'll know you did everything in your power to make your temporary existence on this giant floating ball of gas count. But a housekeeper is going to struggle to make her time count if she isn't conscious during it, so what's going on? Cuddy realized she's been having complex seizures where she's functioning on autopilot because of the extra towels in the bathroom. I mean, if that isn't a house level spot, then I don't know what is. Now they think she's basically sleepwalked the baby out of the room. Maybe her subconscious mistook the cute little human for a giant towel and put them in the laundry basket. Well, hopefully they find them, because it's pretty horrifying to think what would happen after that. So let's find out. I can't take the suspense.
We've covered every room on Maldonado's logs, been everywhere she's been.
Where's the other card?
Lockdown's over.
I should go.
I just asked Sam to dinner. Was there any truth in anything you said?
The part about it being a good idea for you to call Sam.
Once you're fine?
Nah.
Good for you.
See you tomorrow.
I think I'm ready to take you up on your offer.
Lockdown ended a few minutes ago. Yeah, I know. I'm sorry I didn't take your case.
Me too. Gracie was the cutest 6-year-old you ever saw.
Interesting night, huh? Interesting.
They found the baby and completely unharmed. Definitely could have ended much worse, as blankets and towels, basically any kind of soft items, are a massive choking hazard, especially for newborns since they have such little muscle control. Also interesting that nobody heard the crying, but I guess it was in a stairwell. I liked how realistic this episode was overall. When you watch a series like House, it sometimes gives you the impression that everyone has a chance to be fixed, like if we just found that missing detail, then it would all be better. In the real world, that most definitely isn't the case. Trying as hard as we can is equally important as knowing when we need to switch gears and make someone's last days as comfortable as possible. No diagnosis here, but 8 out of 10 entertainment, 8.5 out of 10 accuracy, and 10 out of 10 to Dr. Hadley for sticking to her dare and giving Taub the shock of his evening. This episode makes way more sense if you watch the previous one where a teenage girl's subconscious is telling her something here.